Let's go ahead and start off with the COVID vaccines and what seems to be an increasing frustration between the county health departments and the state of Michigan on supply. Tell us, in Oakland County, when do you know what number of vaccines you're going to get each week?
Well, that's been a challenge. We don't often know in a timely fashion. We put in our order for the week the Thursday prior, so we're asking for a certain amount of dosage on Thursday, and then we hope that by the next Monday or Tuesday we get notified. But that hasn't always happened, and I'm not necessarily blaming the state on that, because when we talked to the state, they said, well, it works exactly the same way with the feds. We put in our order for the state, and then we find out the following week. So the supply chain has been challenging, to say the least.
So for the week here of January 11th, how many vaccines do you have? And then you're going to put that request in on Thursday. How many do you request then for the next week?
So this past week we got 1,950 doses. That's a very small amount. Our hospital systems got more. So that's why I say you may have more luck going through your health system. For next week, we have requested 5,000 doses. And it's not that we couldn't administer that, but we don't want to overburden the state. We know that all the counties across the state are asking for this as well. But we put in an order for 5,000. We'll know early next week what we're going to get. And then that's how many appointments we'll schedule.
Do you find that some of the information is also confusing for people about where they should be going about either getting in line or trying to find some kind of appointment for a vaccine versus where the supplies are when it comes to either the county health department or hospital systems?
We've been really clear about our plan to vaccinate people, and I think the hospitals have as well. But what has been frustrating is the number of vaccines that we've gotten. And, it seems like Operation Warp Speed has kind of is crawling right now. And it's not clear where that breakdown is. I feel good that President-elect Biden has talked about ramping up the production and ramping up the distribution of that. So that may help. But right now, we could make more reservations if we had more vaccines, and that's simply what we're waiting on.
So the news is coming out this week, and on Tuesday, it was announced that the federal government has agreed to release millions of COVID vaccines that were being held back for that second dose. And also we saw news that the governor is offering to buy vaccines from Pfizer, not through the federal government, but on our own through the state. Do you think that is going to be able to help a little bit more in the next weeks?
I certainly think it's going to be helpful, and I applauded the governor's efforts to try to get additional supply however we can. She's aware of this. I talked to her earlier this week, and she understands the frustration. She shares some of it in terms of getting the state to get the vaccines that we need as well. And so 100,000 in the grand scheme of things isn't going to solve the problem, but in the short term, it would really help us get through. Keep in mind, we've been talking about getting seniors 65 and above vaccinated, nurses. These are technically 1B category people.
Yeah, you've opened up a whole range, millions of people who are now eligible.
Yeah, but we only have the supply in Oakland County, at least I can only speak for our county, for what we're doing with our 1A population, and we're not done with our 1A population. So I do want your listeners to understand that at the amount of vaccines that we've received, we're not through 1A yet, which is those EMS workers and frontline health workers and the like. And so I know there's a frustration. We want as many people to get vaccinated who want to be vaccinated to do so. But I also need them to understand that they're going to have to exercise some patience until we actually get those vaccines in Oakland County.
So let's say you're starting to get the supply in. How many people can you vaccinate either a day, Dave, or a week in Oakland County? How do you break that down?
Yeah, that's a great question, because it gets to a bigger point, which is Oakland County itself can probably do up to close to 20,000 a week. But we're not the only ones doing this. So the healthcare systems, the pharmacies, are also going to have access to this. This really is a kind of a public-private partnership. So what I also tell folks is don't just rely on the doses that Oakland County gets. For many people, their quickest access to a vaccination is going to be through their current health provider. So whether for you that's Beaumont or Henry Ford or McLaren, in many cases, you're going to have better luck getting your vaccination through your health provider. So reach out to them as well. And frankly, they've been reaching out to their patients as well.
You know, one thing I think about when we hear the stories, even out of Macomb and Wayne County as well, the phones blowing up at the health department of people who maybe are not internet savvy, who don't know how to go online and sign up for things. What would you recommend that people do if they're not going through their health provider, if they want to get more information from the county? What do people need to do?
So they can go to our website because we update it all of the time. They can also call us, but right now, frankly, Christy, I mean, I don't want to set expectations that we can't meet. We're not adding additional appointments right now until we actually have the vaccines, because we don't want to make an appointment for someone and then disappoint them and have to cancel it. So at this point, it is primarily through our website. And I understand that there are seniors that are older and maybe not as comfortable doing that. I would encourage them, if they can, to get a family member to keep an eye on that for them, to just, kind of keep your eye on our website, but also look for that email from your healthcare provider.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.